Hello, Dr. Ladab Nimsing is my name. I am a consultant hepatologist and I deal with patients with various diseases of the liver. I am particularly interested to discuss with you a very funny story I heard today. It's about a patient who went on to getting urine of an animal, a camel in particular, for the treatment of his hepatitis, and this was very not something exciting for me, but it's very appalling to say the least. This patient must have actually been one of those who would have read or gone across and seen a signpost of people who claim that they have cures for hepatitis B or C or all diseases. I do remember when I was in Nigeria, how that there is so much people who come onto a very big square place and advocate for traditional healing of various diseases. Obviously, when we lived in times of ignorance, our forefathers must have used all kinds of mixtures, sometimes guesswork, and some would have died in the process of their diseases, some would have been cured. And that way, it was believed that cures were possible with certain things. Obviously, we do know that pharmacotherapies are based upon herbs that could have been investigated based on a robust mechanism of discovery. But the crude cures of some of these diseases that are emerging, hepatitis B, which are quite recently discovered, and so on, and may actually have been in existence before now. And because people come on to discussions about who had cures and all these whispers that happen in circles lure so many people to being deceived by scammers, and they are all over the place. They are on Facebook, they are on the Google site, they are on LinkedIn, they're everywhere. There are very big scammers all over the world who are actually after your money. They don't have any interest of yourself. They're not looking at what would benefit you. They're all after what you have worked unhardly for. And so this chap went on to this my colleague and wanted to know about why the hepatitis was there, and whereas somebody had promised to give them a cure that is available in the urine of camel. And now this is really clear from what you can that story, that the person knows that there are no camels in that part of the world, and the person knows that when they go and have to pay for it, then of course it's going to be an engaging exercise. So the person who is going to be receiving that treatment will have to pay money for it, and so that, of course, they're justifying how much the money will come out of this chap, and so on. Now, there are a few things that you can recognize when somebody is scamming you. One, they don't make it easy for you. Two, they will discredit another person who seems to know what they're doing. In this year, 2021, people are still believing that camel urine or urine of some animals can be used as a cure for a disease that we know is caused by a virus. Extensive international research is ongoing, and part of which has actually yielded discovery for the cure of hepatitis C. With ongoing research, it is almost around the corner, and there might be a cure found based on pure science, trying to discover what works and what does not work. But a lot of these scammers will come. One, they will say a name of somebody, maybe prominent name, or a name that you may never discover, or it's a name that is not even indigenous. And two, they will post a picture of somebody who does not represent them. And three, they will tell a story that's a lie, complete lie. Then the last phase would be they'll put a phone number of some scamming group that will form the basis of siphoning you of your resources. I don't know why they do this, but clearly there's poverty in the land. People want to get quick money. And look, if scamming can be done at international levels, which we have been witnesses to, why do we think that it will not be in the health field? I am coming right into the social media as well to say it to many who would care to listen to what I'm saying, that this coming is real and is ongoing and is dealing with the lives of people. Even when it comes to taking multivitamins, I am an advocate for a balanced diet. It is when you have had your balanced diet that you need vitamins to actually absorb and help in digesting those good diets. But if you are yet to even get a balanced diet, you don't even need to go on multivitamins as the first point of call. You just need to eat well. And then you can go on to multivitamins. And that would help. But as to whether there is cure for hepatitis B, as understood by the public, there is not so much at the moment. Research is ongoing, but the treatment that we have currently existing and which is used internationally, this, in other words, the treatment available in Timbuktu is the same as it is in the United Kingdom. Everywhere in the world, there is a standardized treatment available, which has shown efficacy in removing progression of disease as well as development of liver cancer. And so it shouldn't be a surprise that people are agitated and worried and want some quick fix solutions. And then they fall into prey of problems. I know of many of people who are close to me that have died because they would just go for what they thought was available to them and what somebody may have whispered to them. I do remember a story of my friend who we were in medical school together, and my friend just started to have some symptoms of abdominal discomfort, and the next time was, he's traveled, and actually that was quite surprising because he just traveled, and what was he going to do? He thought that whatever he had was not something curable within a hospital setting. Somebody must have fed that lie to him. Obviously, the next I heard a couple of days afterwards that he had died. I was completely taken aback and completely confused. What was it? They told me it was hepatitis. But of course, we do know more. I now know better than that it was a complication of hepatitis. Cirrhosis has developed. Maybe liver cancer, I don't know. But something killed him. But how did that come about? Somebody was producing some herbs and giving him to drink, and that was thought to be the cure for the disease. Of course, perhaps at that time that was what they knew better. However, we now know better than that look, a liver is always vulnerable to any toxins that comes upon it. It will be a foolhardy to go on to adding certain toxins that are too heavy and quite terrible and may actually cause a drug-induced liver injury on top of an inflamed liver. Those are the reasons why the liver will fail fast. Take care, subscribe, and come back for more contents. We will be revisiting this matter from time to time. You do feel free to share this to somebody so that they're able to ask questions. I am a hepatologist. I've done quite a number of years of research in this area. I've treated and managed many patients in this capacity. But I must say that we are fighting against many enemies. Don't be lied to. Access qualitative information, which are all available on internet, and you can verify them. Thank you. God bless you.